Hello, I'm Dr. Alan Laird. I'm the Chief Medical Officer here at the Orange City Area Health System. We wanted to take some time today to answer some questions, some frequently asked questions by our friends and family of the Orange City Area Health System. Thank you for joining us.
Who should get tested, Dr. Laird?
That's a very good question. At this time, we continue to follow the recommendations of the Iowa Department of Public Health for the reason that it gives us a good framework on who is likely to have a positive test and who is likely to have the disease. And I wanted to read those specifically. They largely revolve around if people are in the hospital, if people are of a certain age, certain employment, or certain level of symptoms. So people who should be tested include those that are hospitalized with fever and respiratory problems and no certain diagnosis, people who are older than age 60 with a fever and respiratory symptoms and other medical problems, any person, including healthcare providers, that has a known contact with someone who has had a positive case and now has symptoms, and then people who have had travel outside of the United States that now have symptoms.
Are there enough coronavirus tests available?
Yes, there are enough tests if we follow the criteria. We do not have enough tests at this time to test anybody who would want to test. And so therefore we continue to use the criteria to assist us to testing those people that it will be most helpful in.
How long does it take to get test results for the coronavirus?
We are very blessed here in Iowa to have the Iowa Department of Health and their laboratories supporting us. In general, the turnaround time is 24 to 48 hours. We have neighboring states that it takes much longer than that.
Do you put people in the hospital while you wait for results?
That depends. It depends on what their symptoms and the severity of illness is. Like any time, you may be ill, but be able to manage it at home. And if that's the case, we would ask you to go home and self-isolate and take care of yourself, and we would inform you about the test when we receive it. If you're very ill, however, we may talk about having you come in the hospital until you improve.
Can you treat all coronavirus patients in the Orange City Hospital, or do they need to be transferred to a larger facility?
At this time, we certainly have enough capacity and capability for most people that would become ill with coronavirus and require hospitalization. However, should the case advance and require the needs of a larger facility, we would transfer you on at that time.
What % of people infected with coronavirus require hospitalization?
There is a lot of controversy about that because we're still learning about coronavirus. Numbers range from 5 to 14% of people who have coronavirus will be sick enough that they'll require the hospital.
What % of people with coronavirus have mild or even no symptoms, and what do you do for them?
If there's any good news in this, that's one of the things that we're happy about, is about 80%, possibly more, will have mild disease, a mild cold or a severe cold, but nothing that would require being in the hospital. For those people, we would recommend self-care and stay home, self-isolate, and to do the things that they need to, like taking acetaminophen or Tylenol to reduce their fever, encouraging fluids, and rest. There's excellent guidance from the Iowa Department of Health on their website for those that are well and have traveled and need to self-isolate, and for those that are sick and need to self-isolate while they recover.
If someone does test positive for coronavirus, do you notify everyone that person has been in contact with?
We personally do not. The Public Health Agency, or for Sioux County, the Community Health Partners, is very helpful in assisting with that job. They would be notified by the state that there is a positive case and who that patient is, where they live, and then they are tasked with and have done an excellent job of locating those people that need to be aware and what the contact level was and what they need to do going forward.
How are you keeping health system staff safe? And what happens if you get short-staffed because your employees get sick?
You'll probably notice if you visit us that we're wearing some additional clothing these days. So if you're ill, you may be met by people wearing gowns and gloves and face masks and respiratory masks. And that's so that, number one, we keep our staff healthy, and number two, so that we don't spread it to other people. So we are wearing what we call PPE, or personal protective equipment, if you are ill. And we continue to practice then good hand hygiene, as we always do with that. As far as if we were to become short-staffed, I'm pleased to say that we have an excellent command situation led by Mr. Dan McCarty, who is our Chief Operating Officer, under the direction of our CEO, Marty Guthmiller, which have put excellent plans into place to deal with staffing and staffing issues, if there's any shortage, how those can be addressed.
Does Orange City Area Health System have enough equipment and supplies to deal with this outbreak? And what about hospital beds?
At this time, I'm pleased to say that we are very blessed to have the equipment and the hospital beds we need at this time. However, no one can predict the future. And for that reason, we continue to work with people in terms of acquiring the needed personal protective equipment and additional beds and areas for those beds to be in, should those exceed our current capacity and capability.
In addition to staying home or self-isolating, are there other things we should do to stay healthy?
That's a very good question, and I would encourage you to do some of those things you've always said you were going to do but didn't have the time for. Exercise, eat right, take time to visit with people you haven't had a chance to visit with, preferably by phone, to write letters maybe you haven't had a chance to, so take care of yourselves.
Can people go out of the house at all, to the grocery store or outside for a walk?
Certainly they can. If you're ill, then we would ask you to stay home and maybe get assistance from someone in groceries or other things you need. But if you're healthy, you can be out, take a walk, go to the grocery store, do the things you need to do. However, we would encourage you, please don't gather in groups larger than 10 because we want to prevent the spread of this virus. We would also encourage you to keep that 6-foot buffer between you and others, because that tends to be how far some of those viruses carry. And if you're sick and you don't know it yet because you don't have symptoms, we really want that to not be a possibility to transmit. So we want you to keep that 6-foot distance from others, but you are not restricted to be at home if you're well.
Should people still come to the clinic for other things like prenatal visits, immunizations, or other checks?
Yes, and we believe we've put a mechanism with the assistance from Incident Command into place so that we can continue to serve those vital needs. So examples like getting your child immunized, doing your prenatal checks are things that can continue. You'll see a press release shortly that we have divided our clinic here, that those for ill patients will be seen at the usual clinic here at Orange City, but those for healthy visits, if you'll allow me to use that terminology, would be seen over at the medical building where currently our physical therapy is in. Additionally, we have said in hospitals that we will try to care for well patients there, and ask that those that are ill would travel to Orange City to be seen. And then Mill Creek will continue to see a combination of both ill patients and healthy patients, but they will do their best to separate those populations.
Is there anything else that you can tell us to keep our spirits up and give us some confidence or help us to move forward?
Absolutely. First off, I have had the privilege of being part of this community in Northwest Iowa and the greater area for right around 30 years, and if you'll allow me to go back to a scrawny little freshman at Northwestern, greater than 40 years. I have gotten to see what this area is made of. Together, we'll get through this. Together, we'll rise to this occasion. I have watched the community do it before, and I know that whether it's Orange City or Granville or Hospers or Alton or all the places in between that I didn't just name, we will come together, we'll work together, we'll take care of one another, and at the end of this, we'll be better.